You can go ahead there, Minister.
Thank you. Good afternoon, everyone. Last week, Public Health revised eligibility criteria for PCR testing so that symptomatic individuals who are at increased risk for severe disease or live or work in congregate settings or are essential to keep the healthcare system running are eligible for a PCR test. There seems subsequently to have been some misunderstanding and some misinformation about there. So I wanted to provide some clarity before too much time passed. I believe an important message that's been missed in all of this discourse is the fact there's no change to the eligibility for close contact PCR testing. Based on the close contacts flowchart, if anyone in Newfoundland and Labrador is eligible on that chart basis, they can obtain a free PCR test from Public Health, the same as always. They do not also need to be one of the vulnerable persons categories, such as 60 plus or immunocompromised or pregnant. If the flowchart tells you you're eligible for a PCR, then you can get one. So if you're a household contact without symptoms and do not have access to rapid tests, you're eligible for a PCR. If you are a non-household contact and you do have symptoms, you can get a PCR test if you don't have access to rapid tests. A person is not required to have 2 rapid tests in order to return to work. They must follow the guidelines on the close contact flowcharts. And if people require a test, they would be eligible for a PCR test, the same as always. As well, any healthcare provider that provides direct patient care and has symptoms of COVID-19 is eligible for a PCR test. As Dr. Fitzgerald indicated last week, we changed testing eligibility to focus on the detection and prevention of COVID amongst our most vulnerable populations. So these are seniors, 60 and over, children under the age of 2, First Nation, Inuit or Métis, 18 years and older, frontline healthcare workers with direct patient care, pregnant, living in or working in long-term care homes, personal care homes, community care homes, assisted living or correctional facilities, living in or working in a shelter, transition house, or temporary foreign worker setting, or if you're immunocompromised and potentially eligible for COVID-19 medications, such as Paxlovid. Any senior or anyone over the age of 60 is still eligible for a PCR test. You do not have to purchase a rapid test. There are several reasons why we need to move in this direction. First, it's important that our healthcare system returns to a nearer normal order. Regional health authority staff have been redeployed to COVID swabbing and testing and booking for 2 years. And it's important to get these staff back to their more normal duties. We need to start thinking of a PCR and PCR testing as a clinical investigation rather than a population-based test. For example, when people feel sick with colds and suspected influenza, we don't swab everybody. Instead, we test vulnerable residents, those in high-risk settings, where the threat of spread is more important to manage. Similarly, laboratory processing PCR tests is required for other functions that support patient care. With, in the past, about 2,000 COVID tests being processed each day around the clock, the lab has difficult maintaining that capacity for great lengths of time. So as we continue to resume other services in healthcare, the lab itself has to refocus, and we have to refine our approach to testing to ensure that it's used in the most appropriate way possible. It's important to realize that for those who are not in vulnerable categories, COVID will likely be a mild illness that passes quickly. I know many of you are looking to see what other provinces are doing regarding rapid testing. But I point out that throughout the entire pandemic in Newfoundland and Labrador, we've let public health guide us in our policy decisions. When you think back to the choices other provinces have made in the last 2 years, we've never followed suit just because everyone else was going in a particular policy direction. We set our policies based on sound public health advice, and it has served us better than most places in the country and in the world. And just look at our vaccination rates. They are the envy of the Northern Hemisphere. As we said last week, we provided over 3 million free rapid test kits to residents from a variety of sectors, as recommended on the advice of public health. They've gone to our community through schools, through daycares, shelters, congregate living facilities, ambulance services, corrections, and post-secondary institutions, to name a few. Last week, every student in the province was given a top-up of an additional 10 rapid tests. These can be shared with family and friends and neighbors, especially, however, you need to remember that if you have recently been through a COVID-19 infection, you won't need those tests. They're of no use for 3 months, nor is PCR. An important message I need to repeat is that no test is perfect. Tests will only detect COVID over a certain threshold, what we call viral load. So the combination of vaccines with a milder variant means that we're seeing lower viral loads in many individuals, sometimes too low for rapid tests, and in some cases, too low even for PCR. The main message that we all need to remember is a very simple one. If you are sick, you need to stay home. You stay home until your symptoms improve and you've had no fever for at least 24 hours. I also want to remind everyone that our numbers are updated Monday, Wednesday, and Friday each week through the new redesigned hub with the interactive graphics. And I want to also take this opportunity to express our condolences to the families who may have recently lost family members due to COVID-19. So with that, I hope that's provided some clarity, and I would open it up to Nancy to moderate media questions. Thank you.
Thank you, Minister. We have 3 reporters joining us today. There will be 1 round of questions today, with each reporter being given the opportunity to ask 1 question and 1 follow-up. Our first questions are from Peter Cowan of the CBC. Please go ahead.
Minister, you said that, if families who've received the 10 rapid tests, they're able to share them with other people who may need them. Why is it in order to get a free rapid test, you need to know someone who has a kid in school? Why not make them available to other adults, for example, who may not have those same connections?
We need to use our tests wisely. We follow the guidelines from public health. The discretion around those tests is down to the individuals. For those people who the flowchart says you need a test, a PCR test is available at no cost. I think between those two, we've covered the population.
But what about adults, though, who have symptoms and they don't have a known contact? So they're wondering whether they have COVID-19, but they don't have a kid in school, so they don't have access to these tests. Can you explain why is it that it's only if you have access to kids who have these tests that you somehow get one, but we're not, unlike pretty much every other province in the country, making them available through other means?
If you have symptoms, there is a flowchart to follow. That was designed based on science, based on public health advice, and makes recommendations as to whether or not you need a test. If you do, on the basis of that flowchart, you are eligible for a free PCR, the gold standard test, not a test that is way less reliable under those kind of circumstances.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thanks. Dr. Haggie, if there's certainly a sense of that it's everywhere. I hear from everybody to say, it's everywhere now, numbers going up. Do you see a pattern here that could lead to a return to restrictions anytime soon? I know the number of 40 to 60 in hospital, I think, was given by Dr. Fitzgerald, but the numbers do seem to be climbing. What's your concern there?
Well, we keep an eye on the numbers, obviously, and we've said this all along. And one of the things about COVID is the certainty of change. Having said that, our numbers are bouncing around between the high 20s and low 30s. That is way less than the number of individuals hospitalized in some weeks during our influenza peaks. We haven't seen any influenza. So from a hospital capacity point of view, the care in terms of isolation and infection precautions within a hospital is very similar for all kinds of respiratory diseases. So capacity in the hospital currently is not an issue. We do get regular reports from modeling, and obviously we'll be having some new numbers tomorrow, so we'll be able to see where they're going. But it's trends over time and the impact on the healthcare system.
And I just want to go back to something you mentioned there at the beginning. You mentioned if you had COVID, the rapid test is no use to you. And then I thought you said really lowly, but I wasn't sure, for 3 months.
Correct.
What does that mean? And what do we assume from that? Do you assume that you were positive, you still or could test positive, or what is the purpose of what did you mean by that?
The incidence of persistent positives in people who are free of symptoms is high in the first 90 days after a documented or a COVID infection. So the use of that test within that 3-month period is not recommended. It doesn't confirm or refute whatever's wrong with you. And so all jurisdictions essentially have abandoned its use. I would actually use the opportunity to point out that we're one of the most liberal regimes in terms of access to PCR testing of any of the provinces. So it's a matter of clinical relevance and utility. That's the 90-day problem.
Thank you.
Our next questions are from Mike Connors with NTV. Mike, please go ahead.
Hi, I was just wondering, with hospitalization hitting a record of 30 and the trend pointing upward, do you foresee a situation in the coming weeks where maybe restrictions will have to come back?
I think it will depend on trends over time. 30 inpatients or 31 inpatients in acute care is well within the means of the system to manage. It is lower by 50% than our typical flu inpatient load most years when we see flu. And the precautions, as I've said, are the same for most respiratory viruses. So in terms of the impact on the resources of the healthcare system, we are within what we can manage now, and we have room for an increase should that happen. But again, we'll see what Wednesdays and Fridays numbers look like, and we'll be looking at our modeling in the process.
And again, you talked about understanding. I guess is there a communication problem here? I mean, there was a press release a week or so ago that seemed to fairly clearly limit PCR tests at certain groups of people, and that got the opposition considered. Now you're clarifying, no, they're more broadly available than what was communicated. So is there a communication problem here?
I think the challenge is that people have not heeded what Dr. Fitzgerald said, and what I've been saying today is to try and emphasize that there are people out there put in front of a microphone who are actually providing you with inaccurate information. And that's why I'm here today. The criteria for PCR testing have not changed subsequent to Dr. Fitzgerald's announcement. They may change in the future. There is a likelihood that they may become more of a clinical-based test. We don't swab everybody for flu, for example. We only do it where that would be of relevance to help physicians and care providers deal with the issue. So I think my concern is that the public have the right information.
Thank you, everyone. Minister, would you like to make any final comments for today?
Just really to emphasize what I just said to Michael. I mean, this is occasioned by people who have been misinformed or are misinforming the media and the public. And I'm here to try and make sure the real story, the real information is out there.
Thank you, Minister, and thank you, everyone, for joining us today. Please stay safe and enjoy the rest of your day.
Thank you.